If you let me, here's what I'll do. I'll take care of you.
We take care of the patients with mucopolysaccharidosis. These patients have a genetic disease where they have a missing enzyme in their cells, and so we're able to give back this missing enzyme and help make their disease symptoms less. So Cal comes in once a week, gets an IV, which has already been removed, sits for 4 hours each week receiving his enzyme, and it corrects all the storage in his different cells.
Mucopolysaccharidosis, MPS, and related disease are genetically lysosomal storage disease caused by the body's inability to produce specific enzymes. Normally, the body uses enzymes to break down and recycle materials in the cell. In individuals with MPS and related diseases, the missing or insufficient enzyme prevents the proper recycling process, resulting in the storage of the material in virtually every cell of the body. Keenan Cahill was a depressed kid until his YouTube videos became a sensation. He then made MPS more aware to people and their families.
Keenan appeared to be perfect with a big smile and shiny red hair. But his one-year checkup revealed clicking in his hips, and he had fallen off the height chart.
He wasn't growing as well as another child, and there were some changes in his general appearance, so that ultimately led to the diagnosis.
So how you doing, huh?
Good.
Dr. Barbara Burton says Keenan has a very rare genetic disorder called mucopolysaccharidosis, MPS 6 for short. It affects 1 in every 500,000 individuals, and there is no cure.
The only thing I can remember is they gave me a pamphlet of a boy on the cover, and it said hurler, and a boy on the cover that said Maritolome. And to be honest with you, both of them looked so scary.
In the mid-90s, a bone marrow transplant was Keenan's best chance for survival by replacing the enzyme that protects his bones, joints, and vital organs.
All right, my man. 122.4.
Today, this is how the YouTube sensation spends his Thursdays. A 4-hour-long enzyme infusion at Chicago's Children's Memorial Hospital is his best hope for halting the progression of the disease.
And you've been well, no problems? No.
The drug is one of the world's most expensive, $350,000 a year.
I'm Dr. Paul Harmatz, a pediatric gastroenterologist at Children's Hospital Oakland.
His nurse practitioner. My name's Erin.
How does MPS affect the
biggest
patient?
manifestation is that it makes their skeleton not grow as well. So they end up short, and they end up with bones that are thick, and sometimes the joints, the cartilage in the joints also breaks down. So they have a lot of bone and joint problems. They also have very thick airways, so it's harder to breathe. They have cardiac valves are thick and sometimes don't function well, so sometimes they have to have their cardiac valves replaced surgically. Sometimes the spinal cord, since the bones around it don't grow, normally we have to do a special operation to give the spinal cord room to grow. So those are some of the main problems.
How MPS 6 affects the patient. People with MPS 6 may have symptoms that are slower to develop. At first, some of their symptoms, like constant ear infections, may just seem like a common childhood problem. On the other hand, a problem that is unusual in children, like stiff joints, may be seen as something that affects only the bones. Patients may also have coarse facial features that develop slowly in the first year. By 2 years of age, coarse features may be fairly obvious. Thickened nostril, lips, and ear loops, and enlargement of the tongue are all characteristics that become progressively more evident. The liver may also be enlarged in less severely affected individuals. The large liver does not usually cause liver problems, but it can interfere with the eating and breathing. How much does the treatment cost?
The expense could be anywhere from $200,000 a year to $500,000 a year for each patient.
And then there are also the treatments for specific things like surgeries that patients might need, and those also are, per test that they needed per procedure, that also costs money, and that varies from procedure to procedure.
But we have very good relationships with insurance companies and with the federal insurance program, whether it's Medi-Cal in California or Medicaid in other states in the country, and these programs support this as an effective therapy. So for very rare diseases, genetic diseases, the therapies are usually expensive, but society has recognized that these need to be treated.
How does the government help MPS kids and their family?
The country, by and large, pays for patients that have federal insurance. They support care for these patients by taking care of all of their medical and surgical problems and by paying for the drug.
Like Squidward. Looking for your girl, just missed it. Then my cat daddy and I took her down. Timber. Wrist cold, mama call her winner. Swisher full of nuggets, daddy call it dinner. Baby got, Shelty call it dinners. UPS Jacksons, get it with the liver. Cat daddy when I dug it, cat daddy when I remember. Competition, see the creeds, they surrender. Smoking wide clip, now I'm going to the limit. Move your arms like you wheelchair stuck. Drive low, grab a shot of the life. That power 106 the bang rich. Big up to my bro Sam, he the king of this. Call me SpongeBob. Crack turn the lights on.